Right. So this is probably my story. Also, it might reflect how somebody can evolve as a specialist over a period of time. Where do I come from? I come from a place called Sion Hospital. That was the Mecca of trauma. Dr. Nandulad and my professor, Dr. Ambadekar, as you can see in this, as I was a young, fresh, enthusiastic resident way back in 1991. And you can see a few familiar faces there. Dr. Amol Rege, who was junior lecturer, Dr. Ram Chadda, who was my senior lecturer, and a few other people like Satish Mutha, who is now a big person in trauma surgery. And I believe that spending those 3 years gives you a solid foundation, which sorely is lacking as I see postgraduates today. Unless you have your trauma training very, very good, one shouldn't embark upon any kind of specialty practice, because we need to have our living anatomy, confidence of handling instruments, and thought process in position before we say that I will do a specialty. Unfortunately, what we see today is that we join as residents and first term they say I want to be arthroplasty surgeon. So they feel that it's just dropping out of the sky and you can just go on and become an arthroplasty surgeon. So my gratitude to my alma mater, Sion Hospital, from where I grew, and the inspiration for pediatrics came from my mentor, my close friend, my postgraduate teacher, Joy Patankar. So as you can see, we worked with Joy, we did camps, and that's a photograph of operating on the Lifeline Express. Joy used to take us to Chiploon and other places and make us do pediatric orthopedics, and we were really, really terrified at that time. Joy was interested in pediatric orthopedics, and Dr. B.B. Joshi used to come to Sion Hospital to run trials of his JES fixator. He had just invented the JES. And Joy wanted to use that differential distraction principle with a mini fixator in children. And he used to put it on club feet, arthrogrypotic feet, and make us do the dressings. So we used to curse him and BBG, both. For as residents, we had to do those small dressings and the child is screaming and we had a trauma list waiting and he used to make us do pediatrics. The second memory I have is that he used to make us attend brace clinics. We had this OT PT department and there was a gentleman who used to make braces. And he used to take all of us and make us do the brace clinic and look at polio patients and meningomyelocele. So it was fascinating. Other than the trauma, this was a fascinating new world which I got introduced to. And Sion was a great time, that is Dr. Joy and me giving Dr. Lad a memento on his 30 years of service in corporation. That's Dr. Lad's parents there. I could retrieve this old photograph, and we had made a model of the pelvis and put all implants which could be put on the hip, fixator, DHS. DHS was the thing that time. So there was no PFNA2. And Dr. Lad has always been a role model. And he was instrumental in guiding me throughout my career, as well as he was like the surrogate orthopedic father that somebody needs before one becomes some kind of a successful person. So, sir has always taught us that, Sandeep, you go and work, do good work, do honest work, money will follow. So it was never about the money, it was about succeeding. And he's been there at the back of our head, eating away at our brain. Whenever we think of doing something unusual or wrong, we remember Dr. Lad and what would he do in this situation. And that is what has spurred us to greater heights. And the journey began on the road. I remember Anil Bhatia driving me to Pune in his green Maruti, and I had to listen to his abuses on the road. Truck wala, scooter wala, you know how Anil is. So Anil drove me to Pune with my luggage, and I came and descended upon a different country on the planet, that is Pune, which has its own culture. And from then on, I embarked on this journey, as Pula Deshpande says, तुम्हाला मुंबईकर व्हायचंय, पुणेकर व्हायचंय का नागपूरकर व्हायचंय. And Pune has its own flavor. But एकदा ठरवलं की त्याच्यासाठी मजा नाही. Right? So I descended upon this great institute, courtesy Dr. Nandulad. I had applied to go to UK. I had my papers put in, but for 3 years, 96, 97, 98, there was an administrative problem with the ODTS team. Hemant might remember that. And we were all waiting. So if you see my batch, Samir Dalvi, Taral Nanda, we are all in India. Later on, people again went, and before us, everybody went to UK. So we got probably left back here, and I ended up in Sancheti Institute because Dr. Lad who was great friends with Dr. Sanjay, he said, माझा मित्र आहे, तू पुण्याला जा, त्याच्याकडे तुला चांगलं काम मिळेल, आपला अनिल तिथेच आहे. So I think there was a time when Sion Hospital used to provide people to Sanjay Institute on a regular basis. Shekhar Kumta, Anil Bhatia, Sandeep Patwardhan. So one by one we all came to Pune and settled here. And that is a photo when I joined, when I was really young. And now a recent one, not so young, 28 years down the line. So I can call myself as a true Punekar now because I'm 55 and I was 27 when I came, and now the years in Pune exceeds the years in Mumbai. So I'm one of you. And this is how it has happened over the years. That's Parag, KHS sir and me in the old hospital sitting down taking a picture and planning bigger things. And that's when I told sir that I don't want to be a routine general orthopedic surgeon, though I was doing trauma that time, and I want to do some specialty. So first you need an inspiration like joy, then you need an opportunity, an environment, and then you need to work hard, and then you evolve as a specialist, right? So that is how it went. I remember Pune Orthopaedic Society then, Dr. Dudania, the first POS meeting I attended after coming to Pune was in Inlax. And being an aggressive youngster, Mumbaikar, after the presentations I got up, sir, I have a question to ask. And typical Bombay style, I started, ये तो बराबर नहीं है, ये गलत है, ये ऐसा है, ये वैसा है. Hemant is laughing, so I'm sure that's the temperamental difference between Mumbai and Pune which was there. And then at the end of the meeting, he took me aside and in his gentlemanly way, Dr. Dunai told me, Sandeep, ऐसा है ना, Pune में थोड़ा प्यार से सब लोग बात करते हैं. So I was suitably castigated in a very gentle way that go slow, go easy, and then I realized that appreciation, praising others and looking at the positive part of things makes sense rather than always criticizing and finding out faults, which is the inherent nature of Mumbaikars, especially GSX. So we are very critical of small mistakes. So that is what happened. And these were the picnics. You can see Dr. Parag Bhide and Parag Sancheti, both the Parags in that movie, in that picture there. Dr. Vilas Zog, as usual in his flamboyant dark glasses. Dr. Kering, Dr. Kothari, and Aurora sir, Milind Gandhi there, Panse sir in the background, Dr. Satyashil Naik, Mrs. Naik, Damle sir and Electripala sir. So all these gentlemen were very kind. They accommodated a youngster with fire in his belly, suitably stoked it and tamed it at the same time. And that allowed me to evolve as a person in this city. That's Dr. Salunke and Dr. Hadikar and Shiran Joshi and Colonel Jyoti. So for all the youngsters, POS used to be a family then. And we had picnics and the meetings of the EC used to be at the house of one of the members. Preferably the secretary because only he or the president could afford to feed the others. So that is how it used to be, not in any hotel. And the early years were spent in honing your international experience. So I went in 1999 to Singapore and I joined NUH as a visitor for 3 months and I met Professor Eng Hin Lee. He was a famous person at that time and Singapore offered us training facility with some hands-on experience. The Western world really did not allow us that. And that is where I saw this concept of a specialized pediatric department. There was nothing like that existing in Pune. So when I came back, I told Dr. Sancheti that I want to do pediatric orthopedics and I would like to set up a department eventually which will cater to all kinds of pediatric diseases and will evolve with that. And he was gracious enough to accede to my request and I hung around as a pediatric orthopedic specialist. The other true mentor I had whom we lost recently was Professor Holes. So in 2000 I went to Stuttgart and I had a trauma AO fellowship for which I went. But when I went there after a week, he said that, what is your basic interest? And I told him pediatric orthopedics. So immediately he put me on to Professor Klaus Pasch in the Olga Children's Hospital. And I got to work with Pasch and I spent some time with him in Germany in 2000, braving the cold as well as the food, because that time Germany was not still, it was not EU, it was the Mark. And the food that you got was from the fridge in the ward, which was at the most cold turkey, no taste, and bread. So we survived that And when I came back, what did I learn from this experience? I learned that countries with a population of less than Maharashtra can't really teach a country with 400 million children. They don't have children in their country. So if you want to learn pediatric orthopedics and become a specialist, it is here in India that we have the maximum load of disease, simply because of the volume of children that we have. We need to find our own solutions. Our pathology is different. We have neglect, we have delay, and we have poor primary treatment. So doing fellowships abroad is fine to put on your CV, get some photos and put it up in meetings. But the genuine work comes from working at the grassroots, without which and without the numbers, you really can't talk of being a specialist. But the international journey continued, and this was my first paper in DDH at APOA. Okay, it was the same paper which won me a Arjun, that best paper at MOICon. So I put it in the international and I got selected. So I went to Kuala Lumpur with Manisha at that time. That was our first academic visit abroad. Meanwhile, Joy continued to be a mentor, and he always invited people from abroad, and this is Professor Henry Ben-Sahel. So in 2005, he visited Sancheti Institute, and that's a picture with the team there, and we demonstrated the chest fixator for clubfoot to him. They were then Dr. Ajay Pitre and Shushruth Surgical was trying to market chest fixator in Europe, and we needed him to be convinced that this is a minimally invasive biological technique which involves tissue distraction, like akin to Ponseti, just by instrumentation. So we called it the instrumented Ponseti method. And then I demonstrated a few surgeries. This was the untreated clubfoot, 3 years old, and that is how we put a fixator, and that is how he got corrected, and that is a 4-year follow-up of the child walking around nicely. And we tried to convince Professor Ben-Sahel that you can use this in addition to your method of conservative treatment. But the problem was, as I said earlier, you cannot try to tell Europeans what neglected means, right? There is nothing like neglected in the European world. So trying to tell that post-operative recurrences, stiff feet or neglected feet can be treated by fixator was like pouring water on a stone, because they simply did not understand what neglect means, because they have primary treatment. And then we had Professor Reinhard Graf, another great man from Austria, which Joy got in, and we did the first Graf course in Sancheti, and who told us that better an ultrasound today than a limb tomorrow, and all of us were convinced, and Joy convinced us that in the tomorrow's world, in the OPD, an orthopedic surgeon will be sitting with a ultrasound machine rather than a stethoscope like a physician to diagnose soft tissue problems. And he was right. Unfortunately, what happened was PCP and DT. And nobody after that ventured about buying any kind of ultrasound machine in orthopedic practice. And the radiologists, especially the shoulder guys, either married a radiologist so that their wife can do it. Otherwise, we would have all been sitting in our clinic with an ultrasound machine, diagnosing, injecting, foot and ankle guys. Everybody would have been doing this. But Graf taught us, and this time we had, and Joy was another one who inspired me. Kai Navin Karaycha, get the best person here and then teach everybody around you. So the top guys in Mumbai and India came for the Graf course as delegates. And everybody learned together how to do ultrasound for pediatric hip. And that's the team here. You can see Dr. G.S. Kulkarni at the forefront with all the other people from all over the country. This was the first batch, and I can see Ranjit Deshmukh also there. I think Ranjit had attended this course, and Dr. Abhay Apte and other people. After that, unfortunately, Joy passed away, so which was a big shock. That was 2005. And the second Graf course, which was slated to be done, unfortunately, we had to manage. And in absence of Joy, in his memory, we continued and we did the second Graf course at the Bharati Vidyapit. And Dr. Sanjay Lalwani, whom I must thank, is a big factor. So when you are trying to do a specialty, you need a medical college which can support you. Because Sanjay gave me access to neonates. And the neonatal surgery that I could do, practice, explore, was not possible in Sancheti Institute. Because we did not have a gynec department, we did not have any kind of neonatal ICU. So Sanjay allowed me the access and a visiting right, so that once a week I still go to Bharati Vidyapit and treat children, especially look at their neonates, and now Ashish helping me out there. And that is how it started and evolved. So that's Graf there. So what does it take to be a specialist? If you read Malcolm Gladwell's book, he puts it at a magic figure of 10,000 hours. Like Sachin Tendulkar, if you start playing when you are 14 or 15 and you play 3 matches a day and you face 1,000 balls and you finish your 10,000 hours of practice before you are 20, then you become a specialist. So it is the volume, the repetition and the ability to adapt and enhance skill which is going to make you a specialist. It's not sitting at home or going just to meetings or visiting abroad which will make you a specialist. Now after that, I believe that you need to give it back by teaching. So there is a learning curve, and the learning curve can be jump skipped and you can just get over it by doing camps. So all the camps that Surgery Institute offered, fortunately for me, everywhere there were children. You go to a free camp and it's all pediatrics, neglected trauma and pediatrics. So those camps allowed me to have my learning curve finished in no time, because we just kept operating and operating and operating, and I got to see the rural India, interiors, Bihar, Uttar Pradesh, Madhya Pradesh, and I went really to so many places, and we could take our residents as well as our trainees and fellows from abroad to visit such centers and show them what India is all about. So these are a few pictures looking at the camps that we could do. And then I tied up with the Mukul Madhav Foundation for Cerebral Palsy with Madam Ritu Chabria and the Phenolics Industries, and we keep on doing camps for CP patients in Satara, Ratnagiri. That's a camp at Amravati, and you can recognize a few familiar faces. You can see Yogesh Panchwal there with a lot of hair. Okay, and he was quite plump at that time, and you can see Rishikesh Saraf also with some hair, and a few others, Nitin Wag, who's in Nasik. And we did a camp at Amravati, Nandurbar, Latur, Goa recently, and that gives you a, like I said, tremendous satisfaction. And please remember, it enhances your skill. It enhances your skill, it enhances your sensitivity to rural population. When people come to us asking for concession or discounts or schemes, it's because they really don't have money. A lot of us do see a lot of politicians coming up with fake cards, as well as rich people with gold jewelry coming and asking for concessions. But by far and large in pediatrics, they really are deserving. So at least in our branch, it's empathy which is developed over the years because of the sensitivity you develop after seeing the poverty. So whenever I work, my fellows, my residents, I try to teach them, I tell them, can I do this surgery better? Can I do this simpler? Can I do this cheaper? And can I teach others to do it? So this has been the hallmark of my approach to orthopedics all my life. And with that approach, I have designed a few innovative surgeries, some of which are published, some of which are not. The percutaneous distraction followed by percutaneous centralization and biological repair of the radial club hand followed by policization. Fortunately, this got selected as a poster, and I went to the American Academy and I spoke about it. Rigid flat feet, where I do a percutaneous K-wire assisted leverage technique and I pull up the talus. I do tenotomy on the posterior side, I tenotomy on the lateral side. I put a K-wire, bring it out from the back side, lever it out, reduce the joint and put the K-wire and plaster. So instead of doing reverse Ponseti, I do a primary tenotomy, leverage correction and then give plasters. And I've got really good results. CVT is not a very common disease, but when I get a young kid less than 6 months, this is what I do, and I've got some really brilliant results. Congenital knee dislocation. Again, big quadricep plasties was the norm, or plasters. But what I said, if a tenotomy works in Ponseti, why will it not work in rectus? So we started doing rectus tenotomy acutely. So I do a distal rectus tenotomy, acute reduction. And you can get the knee reduced pretty easily, give a cast, and at 12 months you can see that child walking around nicely. And in the long run, I studied with ultrasound and I saw that the quadriceps tendon regenerates, and hardly anybody has any quadriceps lag. So tissue regeneration in neonates is very quick, and while it is biologically active, provided you don't do massive open surgery which causes fibrosis. So minimally invasive and percutaneous methods will give you good results if you use them judiciously and allow biology to remodel. So these are a few examples of congenital knee dislocation that we treat percutaneously, and within no time you can see active kicking, no quadriceps lag, and everything is fine. Spangle shoulder, when I came to Pune, nobody was operating on spangle shoulders. And they were really, so I started doing the surgery after reading up really. Nobody had taught me how to do it. And over a period of time, we have done over 100 cases now, over 20 years, 25 years. And we've got really good results, and you can see that date there. This is 2000, old camera photo, and this girl now with an 11-year-old follow-up is a young lady, recently married, with very good outcomes. So there were so many congenital conditions which were told मोठी झाल्यावर या काही करता येत नाही, which can be tackled if there is a approach or some kind of a thought process to do it. And again, when I got younger colleagues and inspiration from people like Ashok Sham, who hounded us into doing publications, so we published this technique. Then slowly I decided, or I thought that unless I have a reach through various bodies, a person does not evolve. So I started spreading my wings and I joined the state and national bodies, attended meetings and became a member of the organizing capacity. So Arjun just pointed out 2008-9 I was secretary, and then 10 years down the line I became president of the POS, and I was EC member for 5 years in the MOA with Dr. Patwardhan, Dr. Kakatkar, Dr. Abhyankar, Dr. Nitin Deshpande, and I learned a lot of things about Maharashtra, about the politics of organizations as well as the workings and the inner wheels, because it's always good to have an inner knowledge of how things function. And we were able to do the MOA Con in Pune 2013, 2018. This is a nice picture with all the colleagues, and I could get in people from abroad, the UK guys, Sanjeev Madan, Hariharan, foot and ankle surgeon, and Sunil Upasni from US, and IOCONs, and it was always a great time going all around the country and being a member of a larger or a broader orthopedic community. So steps of evolution, as you go higher, it's important that you become part of organization and take it to the next level. When I was in MOAEC, we started the Meet the Master program. We got a lot of people, we did programs. So we were continuously occupied with academic pursuits. And VIROC was like going back home. So I never missed a VIROC in the last 25 years. And every time I went there, I used to be faculty for one of the pediatric symposia. Nowadays they don't call because they themselves have 25 people doing pediatric orthopedics in Mumbai. So they no longer need you. So nowadays they call me as judge or chairman or something. So that is the natural evolution of things. From faculty, when you start becoming judge or chairman, you know that you have either crossed the hill or they want you to retire. And I think Oration is the last straw. So probably next POSAC, I'll probably be chairman only. Okay. Then the Paediatric Orthopedic Society of India. This gave me an opportunity to look into the workings of a very highly specialized academic body where everybody was a capable individual and a brilliant person and an academician. But fortunately, unlike some other organizations, pediatric orthopedic surgeons are very soft-hearted and very friendly and very, very humble for a very simple reason. We just don't have the money. Right? The poorest branch or the poorest society, we cannot simply indulge in activities which the other societies might do or become larger than life. So all of us are humble, we sing songs and we enjoy within ourselves. Right? We can't have large-scale entertainment programs. Unfortunately, when I was secretary, we had the COVID. So 2 years went not having meetings, but we took that as a challenge. And with OrthoTV, we put up a new benchmark in webinars and web meetings. We were the first one to start web meetings. We did the first web iFix, we did the web POSICon, and we did 36 webinars, 55 hours of knowledge sharing, 50 international speakers, equal number of POSI members, Gurukuls for postgraduates. We had a great time. And then we came out with some collaborative efforts with other societies, and we developed the National DDA Screening Pathway, which is published, and a National CP Hip Surveillance Program, which is again published. And we hope to implement it so that every pediatrician will be able to screen children and we can bring down the load of surgical treatment for CP, hip dislocation and DDH. And I've become recently the vice president and we continue to work. Parag always wanted me to be administrative capacity with the RC. So for a year I was the RC president, and that's a recent photograph. Arjun will be the new president. So best of luck to you. Peripheral visits. So again, as you become a a specialist, you need to increase your footprint. So all of us have gone and done a lot of peripheral visits, and this is the list of, in fact my wife is looking here, I think she must be cursing because every weekend, 4 weekends in the month, 3 weekends I was out. My friends used to always say ki ह्याच्या schedule प्रमाणे party ठेवायला लागते. And हा कधीच घरी नसतो. Either visits or then lectures. So a lot of time, 20 years have gone, but all these have helped. And the next message I would like to say is that you should invest time and money in learning. So once in a while, take a sabbatical. 3-4 years, go away for a month, visit a few centers and learn from them. You may not implement everything that they do, but you can at least broaden your perspective, increase your horizon, and make friends. So I went to Arkansas Children's Hospital. I met Rick McCarthy. I learned the Sheila technique from him. Then I came back and I had a young, fire in the belly, enthusiastic spine surgeon in Sandeep, our dear friend Ketan Kurzekar. And he was so interested in scoliosis, and I was simply not patient enough to operate for 6 hours and 8 hours. So I was happy to hand over the entire scoliosis work to him, and I said that no spine surgery for me. But I went there and I understand, and I think the spine department in Sancheti curses me for this because when they do their post-op presentations, I am the one to pick mistakes. So having spent time in that field allows you to have an insight and a perspective. And it's good to know what they are doing because things are changing with technology, with your navigation, OARM, but the basic concepts don't change. In a growing spine, I learned that how you should manage the growing child. I visited DuPont and spent some time. This is Mihir Thakkar, he just had a baby then, and this is 2009. Mihir is a big onco surgeon today, ortho surgeon in Delaware. And I met Freeman Miller. So Freeman Miller, I met him, I saw his gait lab, and that interested me because CP was something I could deal with. But again, the way they deal with CP with a proper organized manner is not helpful because as I said, neglect and late presentations. POSAC 2012 was a landmark event in my life, and with Benjamin Joseph and Raju there, we conducted, and we had the largest contingent from POSAC at that time. We had workshops, and I am grateful to Pune Orthopaedic Society at that time, which supported me greatly, and we had the largest attendance. We had 630 registrations, which was by far the largest POSAC ever conducted in the history of POSAC. It was the first time that POSAC was conducted in a 5-star ambience in the Westin Hotel. And it was a superb academic event, and I must thank all the pedipods from Pune, Mandar, Ranjit, Ashish, Govardhan, Samir, Rajiv, all of them were active and helped me in this venture, and it was a great opportunity. And I made great friends. And again, when you do something like this, the fallout is people notice. So this is Kay Wilkins and Scott Mubarak. So they came and said that would you like to visit USA, and there was a program called the Poor Scholar Program, which was funded by POSAC. So they gave me the Poor Scholarship, and I could visit 2 centers in USA. So I went to Boston, I saw the Howard Children's Hospital, the Mecca, and I went to the East Coast and I went to the Rady Children's Hospital, and then I could attend the IPOS meeting, which is another great meeting. I could meet Fascia Duval of the Fascia Duval rods, who taught us how to do the fragmentation osteotomies, the pelvic osteotomies. I made some friends, Venkat Das from the Ganga Institute, and I spent time with Scott Mubarak, his team. I saw the camaraderie, and I saw how they organize their department and the emphasis they put on publishing. Again, Dennis Wenger is a man who's got a cupboard dedicated to only his publications. So in Rady Children's, they have cupboards. Dennis Wenger cupboard, they have a Scott Mubarak cupboard, they have a Peter Newton cupboard. Publication only of one person which fill a whole cupboard. Right? We are far away from that. But that inspired me that at least 10% of that we should be able to do. And morning meetings, Chetan, they were there also. 5 o'clock in the morning, I had to go walking from Chantanu's house, cross the bridge and attend the meeting at 6 a.m. where Wenger used to be in the chair criticizing everybody. So I said, okay, good, this is somebody whom I can relate to. Right? So I continue to do that. So rubbing, again, I met James V from Singapore and Kay Wilkins. Kay Wilkins was the one who inspired us, saying that pediatric trauma is something that you should teach. and techniques of conservative methods, and with that need we developed the iFix Foundation. So iFix Foundation was a brainchild of Taral, myself, and we involved Premal and Sheetal Parikh from USA. The need to teach good quality pediatric trauma, and a man is always known by the company he keeps. So like a satsang, I had a great partnership with Taral, who's like a twin brother to me. And we started the first programs with Saraswati Foundation, which Joy had started, of which I was a trustee. And we did multiple programs in Jaipur, in Coimbatore, in Ahmedabad. And Taral has always been my twin, a conceptual twin. Sometimes we don't talk to each other, but we turn up to a meeting wearing the same color combination clothes, the same laptop, and the same model of the phone. Either is equal poverty or probably conceptually similar. And he always jokes that we are brothers from different mothers, and we always share a great relationship. So this is the core team of iFix, and we continue to do the programs. Then we moved to Southeast Asia, and we did iFix Bangladesh, we did iFix Sri Lanka, we did operative iFix in Ganga, and like Modi ji said, Sabka Saath, Sabka Vikas, everybody grew together and we became best of friends and continue to teach and inspire. Sunil Kulkarni and Sushruth, we used to do trauma 1 and we used to do 1 hour pediatric trauma in that. And ultimately we said, तुम लोग हम लोग को time नहीं देता है sufficient. So हमको 4 घंटा चाहिए. So ultimately Dr. Tanna took me aside one day and said, अरे why don't you start your own conference? 1 घंटा वगैरह हम लोग उससे ज़्यादा नहीं दे सकते. So that again spurred us to do iFix. And then they put me onto the AO bandwagon. So they said, why don't you do AO? So I became an AO trauma member. So joining various organizations again puts you in touch with so many other people that it enhances your academic reach. So then I went to Vietnam, the AO Alliance meetings in Vietnam, Bangladesh, Nepal, and taught people learning their concepts about pediatric trauma. On the way I met Dr. Hasanberg, who came to Pune, learned some deformity work from him. These are Dr. Shafiq Pirani and this is how can I actually Bensail Burger, sir? Dimeglio, Alan Dimeglio, sorry, getting old. So Dimeglio and Bensail, and that is Shafiq Pirani, the club foot guys, along with whom I could co-convene in POSI, the club foot workshop. And that's Peter Waters and Durai Nayagam and John and me at the POSI SilverCon. So my philosophy has been learn, work, and then teach. So PG teaching has always been part of my academic repertoire, where I did the Joy Patankar Memorial PG teaching course, the fracture course in science. Always went to Nasik and participated in Dr. Zog and Takatkar's joints. I went and spoke as a PG teacher in home Hyderabad, Dr. Shetty Memorial PG teaching at Mangalore, and our own Stimulus Steve Rocha Memorial with Bharati Vidyapit. So a few pictures where again for 15 years I've been going there, so one day they decided they must felicitate me. So in the Andhra style, they did some felicitation program, and that's me with Dr. Shantaram Shetty at Mangalore. And now we are at a stage where, since we are known and talk some sense, we get invited to international meetings. So that's me at the Singapore Orthopaedic Association as a guest faculty talking, and here I could meet Professor Lee again after 20 years. That's in Lee again, the one whom I went to at 1999, and I spent some moments with him. And I was invited at Cardiff, Discuss, the British Children's Orthopaedic Society at Wales, and that's Claire Carpenter and Sanjeev Madan at Sheffield. Sometimes you get called on TV, so that was a Hello Doctor program, I don't know how much it helps. But Ashok was the one who's made a big change in our approach to research. When he came into Pune, initially Parag told me, you meet Ashok, this is new guy who's doing research, and I was quite apprehensive because we are all very, possessive of our data and our work. We feel that इसको क्यों दूँ मैं मेरा data, उसके नाम में छापेगा, वो famous हो जाएगा. But then we realized that using Ashok's skills in writing papers was the best thing that could happen. And if you look up on Google Scholar, I think I have something like 70 plus publications now, which are in big journals, indexed in JBJS American, JBJS British, and we have written some review articles, and the journey continues. Then we said that there is a bias against Indian papers, so let's start our own journal. So we started the IJPO. So with IORG, and we started the IJPO now, which has become the official journal of the Paediatric Orthopedic Society of India. And then in the Patwardhan, they took up 2 of my video techniques, the Ambod technique, which is there on YouTube for all of you, and slips the anterior approach. So the work satisfaction is what drives me, and it's come from happy patients and patients who come with their mark sheets and medals and meet you, and that gives you more happiness than any money, and you are happy just converting somebody like this to somebody like this, just because you know how to approach that problem, and that gives more satisfaction than probably any money can. So what next? What next? What's the next stage? So like Darth Vader said, strong people don't put others down, they lift them up, and that's what I decided to do, right? So comprehensive pediatric orthopedic services department, which is coming up at Sancheti now, the whole second floor Parag has agreed to give it to me, and we'll have the pediatric rheumatology, pediatric endocrinology, nephrology, all of us will sit together and do comprehensive pediatric work. Training fellows is another passion, so I have a big 15-20 fellows who have trained with me. Continue with CP work with Mission Mukul Madhav Foundation. Continue to running iFix, and then look for inner peace. And my inner peace is sitting in the balcony reading newspapers and taking some photos on my phone, which my wife and kids both curse me for, because they have had enough of my sunsets and sunrises on Instagram. So next time you see one, please ignore it. Training fellows, this is a group of my fellows. I had a fellow from Austria, Vienna recently. He spent 3 months, and probably he's taken back some great memories, and I'm so happy that all of them are slowly settling in different cities and doing well in their life. And we have associates now. I have Vivek as my associate at Sancheti, and we continue to grow the department. The CP work goes on, the iFix work will go on. The iFix is in July, so all of you who are here, please register, and we'll have a great time. And you should have families to support you. So this is my Sancheti family. A lot of us, for many years we are together. Atul, Chetan, both the Chetans, Ketan, who is no longer with us, and Kailash, you can see Yogesh and others in this picture, Ajay Kothari, Varit, Shailesh, and I have my Sion Hospital family, right? Nikhil Pradhan there, Indra sir, the entire gang, Sanjay, Garude, Ram, always having each other's back. Shailesh is here, another cyanide who's been supportive. And Parag has always been a true big brother. I think I am the only person whom he indulges more than all other consultants in Sancheti. I think Chetan can vouch to that. Either he's scared of me throwing tantrums, or he simply loves me. I don't know which one. But either ways, I am the most favored nation status in Sancheti Institute. So I hope it continues that way. And thank you, Parag, for everything. And the other person I would like to thank is Dr. Ajit Gurvilkar, who's also family, who's no longer with us, who supported my wife, gave her a job, and accommodated all our requests, and also was well connected in the city of Pune and helped me with a lot of things throughout my life and supported me as a medical father would. And finally, I must thank my family, my 2 sons, Shaunak, who's an orthopedic surgeon and is doing MCH in Manchester today, and Saurav, who's in Aachen, Germany, doing Masters in Production Engineering. Shaunak recently got married. And the main person I would like to thank is my wife, Manisha, who's here today. Throughout the years, I've haven't been at home, and the reason my boys are good looking is because of me, but capable is all because of her, right? So she's been the pillar who's tolerated all my nonsense. Anytime you come home, you're doing some kind of academic work, घरातलं काहीच बघत नाही, बँकेचं काही बघत नाही, कशाचंच काही बघत नाही. पण तू असताना मला काहीच बघायची गरज नाही. That is what I tell her. He said that's a convenient excuse for you. So remember, to become a successful person, marry a capable wife, right? And thank you, Manisha, for everything today and always. And today again, before I end, I miss my younger brother, Ketan Kuzlekar, who was really a dynamo, and we all miss him immensely every day. And I will sign off on this note, remembering Joy and Ketan. And finally, I would just like to say a big thanks to Pune Orthopaedic Society for all the love and making a Mumbaikar into a Punekar. And like Pula Deshpande said, थोडक्यात म्हणायचं म्हणजे पुणेकर व्हायचं असेल तर म्हातारपणाच्या सत्काराच्या दिशेने वाटचाल करायला हवी. I think that I have fulfilled today, so I can qualify to be a Punekar. Thank you very much.
Thank you very much, sir, for being here.